All right. So, camera pulse, back again. We're going to talk a little bit about what I look for when I'm examining patients that may or may not have a load sensitivity, and where they may be holding load or compressive forces through their body. So the number one thing, picking this up from Martin Langus at the Institute of Orthopedic Manual Therapy in Woburn, Massachusetts, practices out of York. And yeah, I give him a lot of credit, all the credit for this, because this is absolutely coming from him and from his mentors. Anyway, so the first one I'm looking for is manual cervical unloading. So essentially, this one is I'm looking to see if someone is either in pain or has a sense of tightness or anything, usually in a seated position. If they have tightness when they come into the clinic already and just sitting there talking to me, they feel something going on, literally just come up gently behind their head and give a gentle few pounds of pressure lift, ask them if it's same, better, or worse. Okay. If they have issues in where they feel more tightness when they either rotate their head or side bend, flexion or extension, have them go into a little bit of the motion, and then as they start to feel it, give that traction there. Also post a more in-depth video of that technique that we filmed a little bit earlier. So the second thing you're looking for is a little bit I just touched on that first cervical unloading thing is when we check their active range of motion within their neck, what positions are going to be maybe a little bit vulnerable in terms of are there any positions where they feel either an increased amount of tightness, and not meaning because they have more tightness in the muscles on the opposite side of where they're turning, but rather are they getting more compression and load on that side of their neck. Side bending and flexion extension, a little bit different, but do remember that just about for every 1 degree of cervical flexion, there's about another pound because of the lever arm of the head on the neck, 1 pound of pressure going through the neck. So here a head weighing about 12 pounds as we look down. Theoretically, if we were just pulleys and levers, that'd be about 60 pounds. We're obviously not that simple, but sometimes that can create an increased amount of compressive work that has to be done on the back of the neck if someone's in that position for long periods of time. Not saying that's the worst thing in the world, just saying that maybe something they're a little bit sensitive to that we need to pick up on our examination. All right. So the third thing that's really important is passive range of motion, especially of the shoulders. So the things I'm going to look for the most are going to be whether they can get into shoulder external rotation, can they get into shoulder horizontal abduction, and then can they get shoulder internal rotation, testing it in supine or hook line. And I'm going to be looking at can I hold them usually in a scapular plane for their rotations, and then can they get to 45 degrees below the table and shoulder horizontal abduction. Okay. So those are the three things I'm looking for in terms of the passive range of motion testing when the patient's lying in supine. Obviously, we're going to be looking at their infrasternal angle, or their ISA, to see if they're a wide or a narrow. Okay. And if they are and regardless of whatever they are, I want to see as they breathe, is there an expansion and then a compression of the infrasternal angle as they go to inhale and then as they go to exhale, or are they simply just lifting up and down, or is nothing happening? Okay. The fourth thing, depending on if someone works out a lot or if they do manual labor for a job, we want to, in the examination, be able to see how they move when they're doing that action. And so someone has to do a lot of lifting or moving luggage, or they do carpentry, or they got to climb into places. On the questioning, see what types of things are a struggle for them, and watch them as they do it, possibly before we even do our passive range of motion, so we can get an idea of what's necessary for them for their day-to-day basis to complete their job. or if people work out. This is also, especially if they work out a lot or they train at a high level. And then we need to see what's required of their movements so we can get an idea of what we're going to have to work towards and what we really want to pay attention to on our pass range of motion testing. Last one being someone has a desk job. Okay. What we want to do is usually have them talk us through how they sit. And a great piece of information though is if the person can get pictures of them sitting at their desk. Preferably someone else takes a picture of them from a profile view, kind of an oblique view, and then directly from behind them so we can see what their desk setup looks like and make sure that if their position lines up with their active or passive range of motion testing, are they continuously putting themselves into positions that make it difficult to get out of at the end of the day, okay? So those are basically the 5 to 6 things I look at with almost every patient. And that's gonna be part of every examination that comes through with any type of neck, even some shoulder and thoracic pain as well, all right? Reach out if you have any questions.